Good afternoon, dear listeners and viewers of Equinoxe Radio Multimedia. It is another pleasure that we join you all on this edition of your health program, You and Your Head, aired on Equinoxe Radio Multimedia. And for presentation, I am Esia Lucy Liengu. We are in the month of October, which is observed globally as the Breast Cancer Awareness Month. And in Cameroon, breast cancer remains the most common cancer affecting women with a high mortality rate. Therefore, creating awareness for early detection is crucial. Today, with a general practitioner, we'll be looking at the causes, the risk factors, and also preventive measures for breast cancer. But before introducing our guests for today, I have the honor to introduce my co-host. Good afternoon, Immaculate Fogwe.
Good afternoon to you, Lucy. Good afternoon to you, Doctor. And good afternoon to our millions of televiewers and, of course, listeners.
Thank you very much, Immaculate. And our guest for today is no other person than Dr. Elvis METEN. He is a general practitioner practicing in Bonaberry in the Douala 4 subdivision. Good afternoon, Doctor.
Good afternoon, Issy.
It's always a pleasure having you on the program.
Pleasure shared.
Without any waste of time, we'll begin with our first question, Doctor. We are talking to our grandmothers and grandfathers out there. To a layman understanding, we would like to know, what is breast cancer all about?
Breast cancer simply is the development or the presence of abnormal cells, which we call cancerous cells, in the breast tissue.
Mm-hmm. And how does it develop?
Yes, breast cancer, as we rightly said, that it is the presence of abnormal cells, which we call cancerous cells. The body normally, our cells, they do replicate to replace the worn-out tissues. But now, in the advent wherein there's a mutation in the gene, the breast cancer gene, type 1 and 2, which actually help to regulate this activity. Once it is muted or its function is altered, then we can have the onset of breast cancer, because the cells now will multiply without any control and there is no check.
And we do know that sometimes cancer does not pain from the beginning. What are some of the signs and symptoms of breast cancer?
Yes, we have general signs and symptoms which are not specifically linked to breast cancer, but they are a call for concern. Let signs, for instance, if you have a change in the shape or the size of your breast, the appearance, the dimpling, that is like the orange peel skin, then it's a call for concern. You could have your nipples that you have discharge, which could be bloody in some cases. You can have a tender breast, or you palpate a nodule, a mass at the level of the breast or at the level of your axilla. With that, it can give you an orientation, or it's an eye opener that there is something that has to be done.
Tell us, how common is breast cancer at the moment in Cameroon?
Breast cancer, already we have the challenge that having certain statistics is quite a challenge. Secondly, we are in a context wherein visiting hospitals is not our usual routine. But that notwithstanding, following the statistics of Global Cancer Observatory, by 2022, the prevalence of breast cancer in Cameroon was estimated at 5,000 to 6,000 patients in Cameroon, and with an incidence of approximately 2,000 to 2,500. So this number is quite huge, because if we were to take into account all the missing cases that were not even diagnosed and these patients definitely died, then I think we have a whole lot to do. Coupled with the fact that it is not only affecting Cameroon, we are talking about the leading cause of cancer, the leading cancer as far as women's health is concerned in the world.
Are there any factors that could help, let's say, accelerate the development of breast cancer in a human?
Yes, we have factors that could accelerate, as well as could make the environment conducive for the onset of the cancer. Initially, I made mention about the mutation with the breast cancer gene, that's type 1 and 2. We have the age. Women greater than 50 years, that is already a risk factor. We have women, we have late menopause, above 55 years is a risk factor. Ladies who started seeing their menses before the age of 12, that's a risk factor. Women who are constantly on hormone or hormone replacement therapy, that is another risk factor. Now, for ladies, this one I think is quite interesting to know, that breastfeeding could actually help you is actually a protective measure.
Because
yes, breastfeeding. But in our context now, we find ladies, because of nature of job and all whatnot, we have to do mixed feeding for the baby. We don't breastfeed sufficiently. And ladies who have delayed childbearing above 30, that is a risk factor. So every lady out there, if you're you try to have at least a child before the age of 30.
Okay.
Yeah. So those are factors. And alcohol consumption, smoking, inactivity, obesity, those are risk factors to develop breast cancer.
Yeah, in contacts.
Those who like to participate on today's edition of the program, you had the number 670-5470-49. I repeat, 670-5470-49 or 656-622222. 656-622222.
All right, back to you, Doctor. Aside from the other factors you have mentioned, are there other factors like environmental, drinking, cigarettes that can lead to breast cancer?
Yes, alcohol consumption is a risk factor because we made mention of obesity. Yes, most of us we usually adopt a sedentary lifestyle, which is a risk factor not only for the breast cancer, for other cardiovascular problems, for diseases. So it is very necessary. You have to be physically active, regular physical exercises. It is quite encouraged. Alcohol consumption, if possible, stay off it, as well as tobacco consumption. Yeah.
What then should a woman do once she finds out that there is a lump in her breast?
As I earlier mentioned, not every lump is synonymous to breast cancer. Yes. But that should be an eye-opener, because if you're able to do your breast self-examination every month and you notice that something is out of place, it is very normal for you to seek the attention of a qualified physician for proper evaluation, and would definitely advise you on what is to be done.
In Cameroon, is there really a cure for breast cancer?
Cure for breast cancer, yes. We have therapeutic options for breast cancer. Now your cure would depend on the other factors, your age, the stage of the cancer, what level was it diagnosed. Because it's worth noting that early screened breast cancer, if properly handled, you have a success rate of at least 70 to 80%. So you can actually be cured of that. And talking about that, we have therapeutic options, which varies. We have surgery, we have chemotherapy, radiation therapy, hormonal therapy. This therapy can be used singly or in combination. So you can have a combination therapy, probably chemotherapy before a surgery, or a radiation therapy, and that's that. So in Cameroon, you can be managed.
So now, it's clear that there are some cancers that when it's at a certain stage, it can't be cured. In terms of treatment now, what are the options your hospital provides to its patients?
Yes, cancer management is patient dependent.
Okay.
Yes. Reason why I made mention that once you notice anything that is out of place, it is good to consult with a qualified physician, and based on that, your therapeutic options can now be adopted. Because like where I work, we have a gynecologist on board, and all those options, they could actually look into it, and you discuss with the patient what best suits their condition.
Let's look down into the campaigns which are ongoing across the country, but also at your health facility. What role do campaigns play when it comes to early detection and also cancer treatment?
Early detection of cancer remains a paramount. It's a hallmark. It is good to diagnose your cancer as early as possible, because the outcome is dependent thereof, and it is much more profitable to the patient. Campaign come to sensitize the population to actually know that breast cancer is more common than they think. Once you know what are the things that you have to do, at times we may complain about means, but it is worth knowing what your problem is before looking into the possible solutions that you could have. The reason why Peace and Comfort Medical Foundation, where I work, from the 22nd of September this year, which shall run through to the 10th of October, we've been having a free health campaign on breast and cervical cancer screening. And all of these at a very, very discounted rate, just so much that these patients can actually know it costs nothing to come for a breast cancer screening and they tell you everything is normal. You've not wasted your money, you've not wasted your time. But then you are on an alert. Other than staying home and you feel like everything is fine, and before you know it, there is something underneath. Because it's advised that every month, every lady should be able to conduct a self-breast examination 2 or 3 days after your menstrual flow. How many ladies do that? Every year, at least, a lady should go get her breast examined by a physician. But how many do it? At the age as from 40, it is systematic for every lady to go for a breast screening, a breast cancer screening. And in that case, you'll be done a mammogram. But how many ladies do it? So this is an opportunity for everyone to come, know your status. If you're having any pathology underneath, then we can diagnose it as early as possible, and we advise you on what next is to be done.
So what is already at a chronic stage? Is it surgery that is going to be carried out?
And also want to know about the cost. What does it take to treat someone of breast cancer?
Cost?
It varies?
It varies.
Okay.
Yes, it varies. It varies. And not to scare, usually you can have programs that could even subsidize such.
Okay.
Yes, so with that cost, we will not want to talk about cost.
Okay.
It is but good, it's advised.
To at least know your status.
Know your status.
Okay.
Yes.
Then what about the surgeries?
Yes, for surgeries, as far as the cost of surgeries?
No, is it usually successful? Because we know some women are somehow scared sometimes going to the hospital, especially for campaigns, and you're being diagnosed that you're suffering from breast cancer, whereas already at the chronic stage. Now you propose that let's carry out the surgery. What can we retain on that?
Surgery, in as much as we don't have any phobia for paracetamol, we shouldn't have any phobia for surgery. Yes.
Okay.
Surgery is a therapeutic option. Once you're properly counseled by your surgeon, then there is no room for fear, because there is no surgeon that takes a patient to be operated without doing any prior investigations, making sure that all the conditions are adequate for that surgery to be a success. So if the cancer is at an advanced stage and you need a surgery, and that is your therapeutic option discussed with your gynecologist, then I think you shouldn't scare from it. You should go for it.
All right, Dr. METEN Elvis, any last advice for those who are watching out there?
I will advise strongly, know your cancer status. Don't be scared. You are not alone. There is always that support that you can always get from your loved ones. It is better to know your status and you adopt the right measures and live healthily than ignoring it and you have
adverse effects.
Thank you.
Thank you very much, Dr. METEN Elvis, for being our guest today.
Thank you very much.
Thank you very much, Immaculate, for
It's always a pleasure.
Thank you, ladies and gentlemen, for staying with us till the end of your program. For presentation, I have been Ese Lucy Diengu, technically assisted by Jonathan Babiola and Louis Pego. Do well to stay in the company of interesting